Hi everyone. Thank you for joining me for another Stop Loss Saturday. Today's topic is disc herniations. So we're just gonna wait a minute or two for a few more people to hop on. Hope everyone's doing well. And if anyone has any questions, feel free to put them in the comment box and I will comment and I will answer them as they come in. All right, so we're gonna actually get started. So for those of you who don't know, a disc herniation is a very common injury and anyone can have it. Oh, hey Josh. So disc herniations are very common, but a lot of people think they're going to seriously interrupt your life. Now, to a certain extent, that's sometimes true, depending on the severity, but for the most part, it's a temporary setback and they're very easily treated. So what is a disc herniation? So a disc herniation is an abnormality of the disc in your spine. So your discs are the shock absorbers in between your vertebrae. So your vertebrae are built like blocks, and then in between you have these balloon-like things and or discs. And the discs are full of fluid and are kind of structured like rings on a tree. So they're made up of fibers and they circle around. And so then when you have a disc herniation or a disc issue, what's happening is there's an abnormality or injury or tear of the fibers in the disc. So, and let me draw it out for you. So there's a few different types of disc herniations. One is just a basic disc bulge. So a disc bulge is where the jelly, if you will, or the disc material starts to bulge outwards. So like this. Okay, so the analogy I always use for my patients is that of a jelly donut. So if you think of the disc like a jelly donut, your disc is the dough of the donut, and then the jelly inside is the nucleus pulposus, which is the center of the disc, and the material that actually will herniate or exit out of the disc. So level 1 is just a disc bulge. That means the disc itself is still intact. However, the disc material, the nucleus is actually, the jelly material is actually pushing out. Hey, Jackie. And so the reason why this hurts is that on the outside of the disc is actually where the nerve endings and blood vessels are located. So when that disc material starts to push outwards, it's pushing right into those nerve fibers, right into those blood vessels. So it hurts a lot, And so then the second level is when you actually have an actual herniation, meaning the jelly exits the donut and is no longer completely contained. So think like a 5-year-old kid who bites into the donut way too quickly and with way too much gusto, and it comes out all the back end. So then it looks like this. All right, so that disc material is completely outside the donut. Okay, and the reason this causes issues is that you have you have spinal nerves on either side of each level of the discs and the vertebrae. So at each level, off of your spinal cord, off of each level, you have different spinal nerve roots that exit off to supply muscles and ligaments and tendons. And so you have those on either side of each disc, and then you also have your spinal cord, like so, okay? And so then whenever that disc material exits out into that area, then you have massive amounts of inflammation and irritation. A lot of people come into me, oh, I think I pinched a nerve. The good news is 99% of the time, you did not actually physically compress and or pinch a nerve. That pain is from that inflammation that's caused by that disc herniation. It causes actual chemical irritation and inflammation, so that can cause the numbness, the tingling, the burning, and some people even report really odd symptoms such as water running down their legs, things are hot, things are cold, or even creepy crawlies. It's just a hypersensitization of those nerves and the nerve endings, and that causes the pain, burning, and numbness, etc. So that's the first level of the actual herniation. Now, when you have a herniation, there's different levels of severity. Now, the most common one is thankfully the least significant one. So when you have those disc herniations, and forgive my crude drawings, okay, it's not meant to be a medical textbook grade. All right, so you have the disc herniation. All right, so this is kind of a decent representation. So you have the disc herniation out into the area, okay? And then that's the first level. So oftentimes most disc herniations fall somewhere between 2 and 4 millimeters for A to P, so meaning out posteriorly out of the disc. And that's fairly common. You know, it's not usually surgical at that point. And then the second type is whenever you have a disc extrusion, meaning the disc herniation is so large it's physically extruding out into the major space in the canal, and then it tends to travel upwards or downwards. So it comes out and either will travel up or down. So there we go. Okay, so it comes out and goes either up or down. And again, this isn't always surgical. A lot of times this is just easily treated with conservative management, so chiropractic care, epidural steroid injections, or even physical therapy, or a combination thereof. At least 50% of the time, this is not surgical. Then the fourth kind is whenever you have that disc extrusion, so the disc material, again, is exiting out and it's protruding out into that canal space. And then the third kind is when that material actually breaks off. So then you have a piece of free-floating material in your spinal canal, which that is emergency surgery, because the problem with that is then it can break off and travel either upwards or downwards. And if it were to happen to lodge and actually physically compress either the spinal cord or the spinal nerves, it can cause serious and sometimes irreparable damage and or paralysis. So it's extremely important that if that were to happen, that you get surgery. Good news is though, it's extremely rare. So it doesn't happen very often, but when it does, it's serious. So how do we treat a disc herniation? Like I mentioned before, most disc herniations can be treated with conservative measures, so chiropractic care, acupuncture if you like, physical therapy, and also if it's, the pain's bad enough and it's not getting any better, epidural steroid injections, or you can also try a Medgel dose pack. The first level of care that I would always recommend is chiropractic care. Mind you, I'm a little biased, I am a chiropractor, however, I have years of experience treating with success these types of conditions. Now, it's not always immediate, however, within 1 to 2 weeks, you should be feeling significantly better. And by significantly mean at least 50 to 60% better. Now, if you didn't happen to improve, then it would require additional imaging such as X-ray or MRI to make sure that it's not one of the more serious types of disc herniations that we discussed. Also, the Medgel dose pack that I mentioned. So what is a Medgel dose pack? So essentially, it's a package of oral steroids that you take. So you take them in decreasing amounts. So you'll start off as prescribed. I believe it's 6. So you take 6, 5, 4, 3, 2, and 1, and that's per day. So you start off on day 1 with 6, and then by the time you end up with the last day, you're only taking 1. And that helps to reduce that inflammation and irritation in the area. So especially with patients who are having a lot of numbness, tingling, and burning down their legs, and or sometimes even a little bit of muscle weakness, that's kind of touch and go. It depends on how bad your symptoms are with that. But the Medgel dose pack will reduce that inflammation in the area and significantly reduce your pain. The downside to oral steroids is they sometimes have some side effects. Most people, they just feel really hungry, and so their main complaint is that they gain a bit of weight over the next week. Other side effects can be itchy skin, and also I've had a decent number of patients who have actually experienced night terrors as a result of the steroids. Now, those are more rare. However, they do happen, but I definitely, recommend oral steroids, on a fairly decent basis. And as a chiropractor, I don't actually prescribe them. but I will refer you either to your primary care doctor or a nurse practitioner or whoever you'd like to see for that prescription. They're highly effective, and with the right patient and the right condition, you know, I definitely don't have an issue with it. So that's chiropractic care, the Medrol dose pack. In severe instances, we sometimes will refer out to a neurologist or neurosurgeon or an orthopedist for evaluation for an epidural steroid injection. Now, the difference between the steroid injection and the oral steroids is that the injection doesn't treat systemically, so meaning it's not affecting your entire body. So basically, they insert the needle into the area that's affected, and they inject a flood of steroids into the area. So it's very targeted. Now, some people are averse to needles. I can totally understand. I'm a little bit needle phobic myself. So that's one option. And it's as far as procedures go, it's, you know, not severe, and for the most part, it's not very painful. You go home with a Band-Aid, and most doctors who perform it are very gentle and very understanding, you know, because you're already in a lot of pain. They definitely don't want to cause you any more. Now, epidural steroid injections do have limitations. You can only get 3 within 1 year per region. So that is a slight limitation to those. However, most patients, if they are going to be successful, they're most successful, or, you know, they show the most results between the first and or second injection. I usually tell people there's a 30-30-30 rule, and obviously this is a general guideline. So 30% of people, you know, feel better, significantly better right away. They don't really need another one. 30% of people do okay, so they'll feel better for a little while, and then the symptoms will come back. And the last 30% of people will show minimal improvement and or occasionally will get a little worse. So everyone's different, and again, it just depends on your symptoms and how bad they are, and also what else is going on in your case. And so we've covered chiropractic, the Medrol dose pack, the epidural steroid injection. Now, if your disc herniation is so bad that it does require surgery, the good news is back surgery has come a really, really, really long way in the last even decade. So now what they will do for most disc herniations is that they'll go in and they'll use a little scope. They'll go in, it's a minimal incision, and then they will actually go and shave off the back portion of that disc material that's in your canal. So they'll shave it off, and they'll extract it, and then it's done. So it's as far as surgery goes, it's very minimally invasive. It's still surgery, but it's come a long, long way, and people have great results with it. So does anyone have any questions? If you do, let me know. Type into the comment section. Yeah, so oftentimes when I treat patients with disc herniations, some people get better, a lot better within a week. Some people it takes a couple weeks, and some take even 1 to 2 months. Again, just depending on how bad it is, or if they have multiple things going on. The more issues you have going on at one time, oftentimes it will affect your progress, and some areas will get better faster than others. I do deal with a lot of car accidents, so oftentimes people come into me and they have 5 million things going on. So sometimes it's also difficult to differentiate what exactly hurts where and when. All right, guys, well, if no one has any questions, thank you again so much for joining me for Stop Loss Saturdays. Hope it's been educational and informative. Please like, link, and share this video, and I will see you again next Saturday at 10 a.m. for another Stop Loss Saturdays. Thanks, guys. See you later. Bye.